Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. 3 must-ask, absolutely must-ask questions before you take any prescription medication. You should ask these questions when you see your doctor reaching out for the prescription pad, or nowadays as they do typing away on their computer. Ask these questions before taking any pill. And I'm often astounded, even as a doctor, with how many people will simply accept what the doctor says without asking any questions. It's your body, it's your temple. I mean, obviously I'm a doctor myself, but I would never take any medication whatsoever without asking the right questions. So apologies to those of you who are smart. I know a lot of people who watch my videos are very smart. You may indeed already be asking these questions, but there's no harm in a reminder. Here we go then. 3 must-ask questions. Look your doctor in the eye as you ask these questions. Hopefully they look you right back in the eye. Number 1. What are the most common side effects of this prescription you are writing me? I want you to tell me what they are, ranging from mild to the very severe side effects. Could I get something relatively small like a dry mouth? Could I get gastric irritation? Could I get more severe side effects? Could I get very lethargic? Could I get double vision? Do certain people have allergic reactions to this medication? Please let me know before I put this pill into my treasured body. Number 2, what is the worst side effect you have ever seen with this prescription? Hopefully you have a good, honest, transparent doctor who will tell you based on their own experiences. And you should ask this question directly after the first question, because it takes things to a whole different level. It forces the doctor to think and recount their own experiences. Never a bad thing. It dives deeper into what the doctor has personally seen and should make them share this information with you directly. And number 3, can you tell me the percentage benefits from this medication that you want to prescribe me? What percentage of patients really experience benefit? Now this will really sort the men out from the boys or the ladies out from the girls in terms of doctors, whatever way you want to think about it. Because only very good doctors will know this information, and the very least they can do if they don't know it off the top of their heads is go and research it, because it is an excellent question. And this gets back to a larger point that I've talked about many times before. We live in an era where many doctors are mindless robotic protocol followers. I hate to say it, but when you delve into it, they're really not practicing medicine in a very smart way at all. They are following protocol, they are not using their critical thinking skills. And I know medicine is a very tough job. Doctors do a hard job every single day. But there is no excuse for just mindlessly following protocol and not knowing information on the drug you are prescribing. I remember I've talked about this before as well. During the pandemic, my own disappointment when said therapeutic came out. I was one of the few doctors, apparently, who actually took the time to read the research study. It takes about 15 minutes to read, and I saw immediately the problems with absolute risk reduction and number needed to treat, the true statistical benefits that were not the same as you were hearing in the mainstream media and from the medical establishment. And things like this happen because doctors are not doing their real job. It is not enough to mindlessly follow protocol just because our authorities say so. We should be using our God-given brain, pulling up the research ourselves and breaking down the numbers so that we can share this real scientific information with our patients. Isn't real science what this is all supposed to be about? But anyway, don't get me going on that. But it is a very valid question indeed, and only the very best doctors will like being asked that question, because it is an excellent question, and I love it when patients ask me. I will pull up research and I will share it with my patients, because it's all about making informed decisions. Our bodies are very precious indeed, and the least we can do as doctors is know the correct information and not mindlessly be repeating things and doing things like trained chimpanzees just because we are told to. The practice of medicine should be much more than that. So those are the 3 questions then to focus on. Obviously there are others as well, especially in the United States of America, like how much is the medicine going to cost? Are there any alternatives? But I would like you to focus on those 3 questions. Number 1, what are the side effects of this medication that you want to prescribe me? Number 2, what is the worst side effect that you have ever seen, doctor? And number 3, tell me the true percentage benefits of this medicine? How much will it really benefit me? What are the mortality benefits? What are the other benefits in terms of alleviating symptoms? And obviously that last question applies more to certain medications than it does to others. Many chronic disease medications, statins, the new heart failure medications, I'll have to talk about that sometime as well. But the true percentage benefits are not anywhere nearly as good as you may think. It's all about you making the correct informed decision for yourself and your family. Thanks everyone for listening. Let me know your thoughts down below. Feel free to comment. Check out my online academy. That link is down below as well, as is a link to my Uncensored platform. Hit the like button if you like this video and the bell button for more similar videos from me in the future. Take care everyone, and we will speak again next time.